There are two options for the cardiovascular assessment. There is the 3-minute step test and the 6-minute walk test. It is preferred for the member to complete the 3-minute step test, but if they are unwilling due to instability or would rather do the 6-minute walk test, it is available. To set up for the 6-minute walk test, measure 30 meters and place a noticeable marker, cone or tape at each end. Place a chair near the walkway in case it is needed throughout the test and for post-test rest. Have a printout of the ratings of perceived exertion nearby for quick reference. Next, screen the member for any contraindications to testing based on their intake form. Measure the member's resting heart rate, oxygen saturation, and ratings of perceived exertion. Standing at the starting line, use the following script to instruct the member. The object of this test is to walk as far as possible for 6 minutes. You will walk back and forth in this hallway. 6 minutes is a long time to walk, so you will be exerting yourself. You will probably get out of breath or become exhausted. You are permitted to slow down, to stop, and to rest as necessary. You may lean against the wall while resting, but resume walking as soon as you are able. You will be walking back and forth around the cone. You should pivot briskly around the cone and continue back the other way without hesitation. Now I'm going to show you. Please watch the way I turn without hesitation. Walk with the member if they do not appear safe enough to do so alone. When the member begins walking, start the stopwatch, keep the time running for the entire 6 minutes, even if the member needs to take breaks throughout. Record the laps complete throughout the test in Table 2. Encourage your member throughout with the following scripts. After the first minute, "You're doing well, you have 5 minutes to go." 4 minutes remaining, "Keep up the good work, you have 4 minutes to go." 3 minutes remaining, "You're doing well, you're halfway done." 2 minutes remaining, "Keep up the good work, you have only 2 minutes left." 1 minute remaining, "You are doing well, you only have 1 minute to go." 15 seconds remaining. In a moment, I'm going to tell you to stop. When I do, just stop where you are and I will come to you. If the member is unable to complete the 6 minutes, record the time left, the distance walked, and the reason for stopping in test in the Table 3. Also measure and record post-exercise heart rate, O2 saturation, and ratings of perceived exertion. Once the 6 minutes is over, allow the member to sit in the chair and measure the post-exercise heart rate, oxygen saturation, and ratings of perceived exertion. Add together the tallies and record the total tallies in Table 2. Multiply the total tallies by 30 meters and record the results as a total distance walked. Use equation 1 and calculate the member's VO2 max. Classify the member's VO2 max based on their age and gender. For the 3-minute step test, you will need a metronome, 12-inch step, stopwatch, and chair with back support and armrest. Set the metronome close enough to the step so the member can hear loud and clear. Have the chair close enough to the step so the member can sit immediately in it after the test. Screen the member for any contraindications to testing based on the intake form. Explain an overview of the step test to the member. Set up the metronome to 96 beats per minute. Demonstrate how to step up, up, down, down with the beat of the metronome. Answer any questions that the member has about the test. Make sure the metronome is loud enough for the member to hear and allow them 5 to 10 seconds of practice to get used to the beat of the metronome. After the practice time, begin the stopwatch on the member's first step. Continue for 3 minutes. If needed, allow the member to rest in standing. Give 2-minute, 1-minute, 30-second, and 10-second warnings. Once the 3 minutes are up, have the member sit immediately down in the chair. Let them rest for 5 to 10 seconds, but no longer. Measure the member's radial pulse for 1 minute. Record the number as the recovery heart rate in beats per minute. Classify the recovery heart rate based on the age and gender in Tables 1 through 2.